For over 40 years, America's health centers have delivered basic health care to hundreds of communities in need. From humble beginnings in poor rural communities and inner cities, they have evolved into a vital safety net for millions of the uninsured and vulnerable. But 40 years ago, health centers did not exist. And without few committed people and organizations, they might never have happened. In the early 1960s, a nation was awakened to millions of Americans living in poverty. Women and children, migrant farm workers, the disabled and frail elderly. In Mound Bayou, Mississippi, and the Columbia Point neighborhood in Boston, Doctors Jack Geiger and Count Gibson pushed forward a radical new idea. It would change the course of healthcare delivery, a community-based model of healthcare that was to serve all people regardless of their ability to pay, and give patients a voice in how that care was delivered.
I thank you all for coming out tonight, and I'm always proud to come to the Health Association.
Our concept of health is to make social change, to build the institutions that can make social change and keep it going. We call it community health action.
As political leaders began to understand their impact, health centers became a key part of the nation's war on poverty.
So there was a different sense in time. There was an expectation that something would be brought about that would change the conditions of people. The proposition was, rather than having people go to the doctor, why don't we have the doctor go to the people?
At the founding of the community health center movement, the federal government stepped up and basically said, we are going to determine and intervene into individual communities across America where there's great underservice, where there are great gaps in access to primary health care, and we're going to fund these things called neighborhood health centers or community health centers.
Maximum feasible input was the phrase that was used. What it meant is that you literally went to a migrant camp and you sat down with the migrant workers early in the morning or at lunch or late in the afternoon or evening in order to have a conversation about what is happening in your community and what of that can we be helpful with.
I was nursing in a hospital and felt the need to provide service for the working poor. I call them the working poor. They're the people who made $1 too much to get health services. At that time, Community Health Center was called the OEO program. So I said, let's get a committee together and let's get started. 1972, we opened up the doors in a church basement.
I was the first director of La Clínica del Valle in Rocky Ford in 1973. We were the community in that part of the state that didn't have money, didn't have access to care, didn't have preventive services at a time when the local private community insisted, medical community, that things were okay and were being taken care of.
The idea of providing services where people are was very controversial. I can remember very concerned physicians from the Medical Association having very specific questions about who was I to be talking with them about the development of outpatient services because they were the experts.
She's got to wait until she sees the doctor.
You never had enough money. You know, you was constantly trying to survive, and you wasn't sure for the next year whether you was going to get funded or not.
After 10 years as a successful demonstration project, the health center program was made a permanent part of the Public Health Service Act in 1975. By then, health center leaders had joined together to establish the National Association of Community Health Centers. Health centers recognized that their future depended on the ability to work together and to speak out for the needs of their patients and centers. Yet there were challenges on the horizon. In the 1980s came the threat of block grants, and health centers risked losing the federal commitment to help people gain access to care.
The government was into the process of restricting itself, of trying to take things that were at the federal level and sending them to the state level. What we literally had to do as health centers was organize in a straightforward fashion in order to educate and inform the policymakers and the people who influence policy so that they could understand what this program was. We were able in the early 80s to convince the Congress not to block grant the program.
And there were other challenges: the need for stable funding, fair reimbursement for services, the need for more health professionals to meet emerging health problems, drug abuse, homelessness, and HIV/AIDS.
A group of leaders at the national level, including state leaders like myself, in 1985 and 1986 made a very specific determination that it couldn't be federal grants alone, that we had to look towards state-based funding, principally through Medicaid, Title 19 of the Social Security Act, to really expand and broaden the health center's impact on their communities. Today, Medicaid and Medicare are really significant players in community health center financing and funding.
At nearly 5,000 delivery sites in urban and rural communities, America's health centers offer accountable and cost-effective solutions to controlling healthcare costs while expanding access to care.
I think the other piece has been to not focus on the politics of the thing, but to focus on the delivery of the services. Now, we have a president, for example, who for the first time ever articulated the need to expand services in health centers. And we are in the process of the largest expansion I think the program has ever experienced. Part of that is that he was convinced locally when he was the governor of the state of Texas that health centers were part of the answer to the question of how do we provide services in an effective way that is economical and at the same time has quality.
Because in the end, if we don't do it right, those patients end up in emergency rooms and, being admitted for unnecessary hospitalizations. If we were doing our job in prevention and chronic disease management, we save lots of money.
We have buy-in from the community to really partner to build successful relationships to increase access and reduce health disparities in the community. The faith-based organizations, the community-based organizations, the local social service agencies, the schools, the libraries.
Insurance companies, corporations, county governments, city governments, state governments, they've got to understand and we got to communicate with them more what we're doing.
We represent those that are doing this work, that are taking care of almost 15 million people in this country and doing it at a level that is recognized now as being one of the most cost-effective programs that we have in the federal government.
It's a simple message. People get it. It makes intuitive sense. It's practically proved itself. We're demonstrating how cost-effective it is.
We've always known that. But now it's the government itself that's saying, this is an effective way to deliver primary care, and we need to support that.
The health center movement that began over 40 years ago has become more than its early pioneers could have ever imagined. America's health centers continue to carry forward their mission to bring health care to people in need. Theirs is a promise made and a promise kept to people and communities across the nation.
What we do is unlike anything that's done in the private sector. We meet that panorama of needs that our patients come with. Not just being bilingual, but being multicultural, understanding the nuances of someone when they shake their head or shake their hand. That's that whole array, and that's the package, that very rich package that we in community health centers are able to provide for our patients.
The folks that were involved in this movement from the beginning showed us the way. They inspired us to stay committed
They have lived that mission and that passion. When the resources aren't there to continue to provide the services, the first thing they do is they go out and find the resources.
Community health centers exist because many, many people have gone before. That needs to be protected.
The challenge will continue to be growing our capacity.
I think we need it. And until we go into some universal health care, we're going to be needed. And we're going to need a movement.
On their 40th anniversary, congratulations is extended to the men and women of America's health centers and their support organizations, the National Association of Community Health Centers and state and regional primary care associations. Together, they have produced a living legacy of service and leadership in healthcare. We thank their volunteer board members, the doctors, nurses, and staff, the patients, and the many partners and public officials whose work and support are building healthier communities for tomorrow's strong future.